Public health as a social phenomenon from a biblical perspective. Automated identification. The authors, Halyna Tesliuk from the Ukrainian Catholic University and Olha Kulyna from the Lviv Polytechnic National University. The aim of the article is to define the issue of public health as a science and to create an overview of public health perception in the Hebrew Bible Old Testament. Public health is the science that aims to protect the health of people and communities multidimensionally and holistically. This is accomplished by promoting healthy and environmental friendly lifestyles, providing equal access to the medical services and care, researching and detecting various diseases, preventing and addressing the emerging infectious diseases, to name some of the aspects. The World Health Organization, in its preamble to the Constitution, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity. Moreover, the WHO claims that enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. Many scientists have recently put their interest in the discussion of public health, and they distinguish four key factors that affect the health of the community. Physical factors, geographical location, environmental situation, community size, industrial development. Social and cultural factors such as religion, traditions, economy, politics, and social norms. Community organization, how community is able to mobilize and work together. And finally, individual behavior, the responsibility of each person for the well-being of other members of a given community. Religious stance plays an important role in how people react to the state policies of public health. For instance, some religious groups do not accept the possibility of blood transfusion for a sick person. Some prohibit immunization and even to be treated by physicians. Some discuss the moral issues of abortion and euthanasia. George Rosen, in his seminal work, A History of Public Health, traces the concern of human health back to the time of ancient Mesopotamia and Egypt. However, he only briefly mentions the text of the Hebrew Bible and Old Testament. Still, ancient Israelites, as modern people today, also face different types of problems related to what we define as public health. How to control transmissible diseases, how to tackle the lack of good food and water supply, how to properly provide medical care, how to keep good hygiene, how to deal with people who are mentally and/or physically disabled, how to live holistically. The Hebrew Bible or Old Testament contains instructions in biblical parlance laws how to an individual and the entire community should live healthy. These biblical laws and precepts are religious in its nature. Yet they aim at the physical and mental well-being of the chosen people. In other words, what one finds in the Hebrew Bible or Old Testament is a compendium of instructions for a community how to organize and preserve its own health. It should be noted that there is no dichotomy between the soul and the body in the Hebrew Bible or Old Testament. A human being is perceived as one entity, as one living soul. As Larry Paul Logan correctly observes, in regard to illness, he, a human being, cannot be ill only in body and health in his mind or soul. For that reason, the perception of a person is holistic. The Hebrew word shalom, in English can be translated as peace, prosperity, describes the harmony of relationships between humans and God, humans and humans and environment. It also refers to the holistic view of the life of an individual, including his or her health. To live holistically, meaning healthy in biblical terms, means to eat clean food and to avoid what is forbidden, to moderate the amounts of alcohol, to keep hygienic rules and to avoid contact with the corpse, to go into quarantine if someone diagnosed with a skin disease or other possible infectious disease, to take a rest from work, in biblical parlance, to observe the Sabbath and other holidays. It takes discipline to be healthy. Maintain one's mental health, in other words, to enjoy one life, to leave all anxieties to God. To remember that keeping the law is a responsibility towards our own community as well. For our study, we have chosen this English translation of the Hebrew Bible. The title is The Holy Scriptures According to the Masoretic Texts, a new translation with the aid of previous versions and with the constant consultation of Jewish authorities. The method of observation helps us to collect data for the research. Comparative method reconstructs collected data on public health with the present view of the notion, based on comparison of related words. Classification is used to group units according to their degree of relatedness. Searching for common properties of data to formulate general concepts is based on generalization. At the final stage, we introduce interpretation, which is a process to explain and convey a meaning of terms accurately and efficiently. To make the linguistic analysis of key terms, we use Sketch Engine, an online text analysis tool. This tool can work with a large number of texts in order to identify typical and most frequent usage. In this and the following slide, you can see the steps we have taken to do the research and to analyze the data. In total, there are 10 steps that we have taken. We have two hypotheses. The first one. Methodological approach of modeling has been applied to single out the most appropriate nouns which denote the meaning of public health in the Hebrew Bible Old Testament. This hypothesis will be tested by a comparative analysis of collected data, their statistics, and classification. The second one, then we intend to see a word sketch with the most typical combinations by processing words with collocations and other words in its surroundings. It is essential to emphasize that based on prior research, public health includes taking care of the quality of life, living holistically with God, others, and self, eating healthily and being moderate with alcohol, taking care of the body and its hygiene. Remember to rest and give others this possibility. Bring others joy and encouragement. In our article, we have researched the grammatical relations of each concept. These relations can be as following: words that serve as an object of the noun, words that serve as the subject of the noun, words that modify the noun used with and or, prepositional phrases, adjective predicates of the noun, pronominal possessors of the noun, verbs used with the noun. Figure 2 that you see here is the scheme of the grammatical relations of the word life. This figure provides an information about the grammatical relation of the word blessing. Here we see the grammatical relations of the word peace. In this one, grammatical relations of the word and concept clean. Here, the grammatical relations of the word unclean, grammatical relations of the word rest, grammatical relations of the word health, grammatical relations of the word joy. The results of the research have shown that public health played an important role for people back in history. In the Hebrew Bible, Old Testament, we came across with many examples of health issues. Hypothesis 1 verifies that the applied methodological approach of modeling is helpful in sending out the most appropriate lemmas denoting public health: life, blessing, peace, health, clean, unclean, rest, and joy. The results showed that life, peace, rest, unclean, joy, and clean are the most frequent lemmas to denote health. The fact that the lemma health was used only 9 times was surprising. This hypothesis was tested by a comparative analysis of collected data using a statistical approach. Hypothesis 2 proved to outline grammatical relationship of each lemma to the most typical combinations, collocations, and other words in its surrounding. Thank you for your attention.